Good evening, everyone, and welcome to the New South Wales Family Daycare Association webinar on meeting element 2.1.2 of the NQS in family daycare post-COVID-19. We're going to get started shortly. I just need to go through a bit of housekeeping before we do. If everyone would like to say a quick hello to me in the question box so I know that you can hear me and that you can see the slides, and I'll get started while we wait for a few more people. So this session has been created for family daycare educators who attended the Great Spaces, Safe Spaces training session, and for those who would have been involved in the study groups at the end of last year or the beginning of this year, which were interrupted by COVID-19. Before we commence our webinar, I would like to acknowledge the traditional owners of the country on which I am presenting from today. We pay our respects to the elders past, present and emerging, and to all Indigenous people present. We acknowledge that Aboriginal families have cared and educated for children on this land for tens of thousands of years. My name's Elizabeth Goh and I'm going to be your presenter for this evening. And just a bit of housekeeping before we start. So the content of this webinar is provided for information purposes only, and we've tried to ensure that it is as accurate as possible. All the slides that you see tonight are available for you to download as a PDF document, and they're in the handout section. So if you undock the handout section, you'll see the document there, so you'll be able to keep all of these slides. We do encourage you to take some notes as sometimes we go into more detail, so you're welcome to take notes as we go. Also, everyone is muted throughout this session, so you can hear me, but I can't hear you. It just gets a bit busy with background noise, and we do have quite a lot of participants tonight. Also, your certificate of participation will be sent out next week. So you will get sent to your email address. And lastly, if I can just ask everyone to put their full name into that question box before the end of the webinar. This is so we can ensure that the correct name is on the certificate. Sometimes if people can't attend a webinar, someone attends in their place. So we want to make sure that the correct name's on the certificate. Once we issue a certificate in one name, we won't be able to reissue it in another. So if everyone can just take a minute to put in their name, that would be really helpful. Okay, fantastic. So lots of content in tonight's session. We'll be going for about an hour. So we won't take too much of your time, but we do go through quite a bit of information. So we'll be looking at routine cleaning, what detergents and disinfectants should educators use, excluding sick children and the issues around that, excluding sick adults and staff, immunisation and social distancing in family daycare. So we're going to look at what educators need to do to meet element 2.1.2 of the National Quality Standard post-COVID. And this session has been funded through the Early Childhood Education Directorate of the New South Wales Department of Education. So let's start by getting an understanding of what is element 2.1.2. So what is element 2.1.2 of the NQS and what does it have to do with COVID-19? So we know that 2.1.2 is part of Quality Area 2, Health and Safety, and the aim of Quality Area 2 under the National Quality Standard is to safeguard and promote children's health and safety, minimise risk and protect children from harm, injury and infection. Standard 2.1 is about health, so ensuring that each child's health and physical activity is supported and promoted. And element 2.1.2 focus is on effective illness and injury management, and hygiene practices are promoted and implemented by educators and services. So it's the hygiene practice part of this element that is important when we look in the context of COVID-19. So in other words, hygiene or infection control that will protect children from catching COVID-19 in your home or spreading it to other children. That's really what we want to be focusing on tonight. So the New South Wales Family Daycare, we actually have a document called What to See, Say and Show. This is a resource that's available to purchase through our website. It's a really useful website resource when you come to assessment and rating. And what it does is it breaks down every standard and every element within that standard of each quality area. And it gives you ideas of what you can show, what you can say, and what the assessment and rating officer will be looking for each quality area. So it's a really fantastic guide if you are going through assessment and rating, or if you've got one coming up soon, or even if you just want to refresh your mind on what kind of things you should be looking at in your quality improvement plan. This is a great document. So obviously tonight we're going to be looking at 2.1.2. So we'll go through the See, Say, Show method for this element. So if we look at first, what would an assessment officer see? So when an assessment and compliance officer comes to assess a family daycare service against the National Quality Standard, they need to find evidence that you are meeting or exceeding this standard. And so how do we do this for this element? As described in the Early Years Learning Framework and also the Framework for School-Aged Care, so your My Time, Our Place, if you're using that framework. Educators facilitate effective hygiene practices in family daycare by engaging children in experiences, conversations, and routines that promote healthy lifestyles and good nutrition. So what would an assessment and compliance officer see in a family daycare service around this element, this 2.1.2? So they might be looking at hygiene practices that reflect best practice and advice from relevant health authorities. They might be looking for educators implementing the service's health and hygiene policy and procedures consistently. So making sure you've got something documented, but not only is it documented, that it's actually being followed and implemented and consistently. So all staff are doing it. Educators actively supporting children to learn hygiene practices, including hand washing, coughing, dental hygiene and ear care. Cleaning toilets and nappy change facilities in the appropriate way, and educators and children implementing appropriate hygiene practices for hand washing, toileting, nappy change, and cleaning of equipment. So that gives you some ideas of what an assessment officer might want to see. When we look at what would an educator or service say, so this is when they engage in conversation, and it's important to note that they won't just engage in conversation with the director or your nominated supervisor or your approved provider. They can talk to any educator, so they can engage in conversation with you at any time. And so what would you say about this element? So you could discuss how educators and or the service finds and accesses information on current hygiene practices, how cleanliness is consistently maintained in your home. So it's not just kind of on an ad hoc basis when you have spare time. We want to make sure that we're doing cleaning on a routine basis. And how you maintain a regular schedule of washing children's toys and equipment. So you might have some documentation to go along to show them as you're telling them things as well. And the last thing we look at is what would an educator or service show? So what do you want to show the assessment and rating officer? So you might show them things like health and hygiene policies and procedures, so all your documentation around that, written procedures and schedules for maintaining a regular regime of washing children's toys and equipment, evidence that families are provided with information and support that help them follow the service's hygiene procedures. So how are you supporting your staff to do that? And hand washing posters, they might be in the bathroom, or any visual aids as well for the children, on how to do effective washing and hygiene practices. We know that children work really well with visuals, so that might be something that you could show them. So now that we have gone through the COVID-19 virus, it's important to think how things have changed for us now in family daycare and what these changes involve. And that includes what might assessment officers now be asking for, or how our compliance has now changed. So some things to think about post-COVID is assessors may be interested in you saying what they can see or be shown. So things like additional cleaning, distance and precautions that you're taking. So they might want to see a bit more of that. Um, Checking that your service has done a risk assessment on the pandemic, so that you've acknowledged that we are going through a pandemic, and what does your service do about that? What's your action plan if something were to happen? An updated policy or a risk assessment or risk minimization plan to take into account any children who have underlying medical conditions that may affect their risk from the virus. So if you've got children with additional vulnerabilities like underlying health conditions, or any other circumstances that may make children more vulnerable, how are you considering that within your care, and what are you doing for those children and their families? Information you're sharing with parents about the virus and minimizing risk to the children in your care. So are you constantly updating your families about what's going on, not just within your centre, but connecting them to the community as well? You might provide updates from the Department of Health, or have snippets in your newsletter about what's been happening in the local community and how your local community is affected. Your service can actually be a really good gateway for parents to get current and up-to-date information. So it's a great idea to show how you're doing that, how frequently you're communicating to parents about the pandemic, how you can quickly update and access all of your parents if something were to happen, or if new information was received, or the government brought in changes. How can you quickly pass that on to your families? If you had an action plan in place if there was a positive case at your service. So that's something to be really mindful of. You know, if it's not great practice to plan for that when it happens. We want to know what we're going to do ahead of time. Okay, if one of our staff or parents or children were to test positive to COVID-19, what are we going to do? What's our plan? And it's best to have at least an idea of what that looks like before it were to actually happen. And then just keeping in mind all the things that you already do, but an assessment officer might want to see more of that in relation to 2.1.2. So additional cleaning and additional precautions. Okay, so next we'll look at key things to keep everyone safe. So all staff and children who are unwell must remain at home, and we'll talk about how we can effectively manage this a bit later. So hand hygiene, cough etiquette, and environmental cleaning and disinfection um, are the most effective ways to reduce transmission of coronavirus. So embedding hygiene practices for children into the daily routine and into the educational program to show you're encouraging children to take responsibility for their own health and safety, and teaching them the correct way to sneeze, or teaching them what to do after they blow their nose. So it can really be embedded in your educational program and into your routine. And that's something that we should all be doing. We want to empower the children to take care of their own health and safety. Parents, carers of children with complex medical needs should seek medical advice from the child's medical practitioner to support risk assessment and informed decision making regarding the suitability of continuing education and care at this time. So for some families, it's really just not practical or advisable for them to continue going to care just because of that additional risk factor to their family. So treat each family individually and unique, which they are, and make sure we don't have a kind of blanket approach. Different families are going to have different needs. Staff, children and parents or carers should have their influenza vaccination, so their flu shot, whenever possible. And you need to clean more frequently. And remember, the greatest risk of transmission in the early childhood environment is between adults rather than the children. So I think we know as early childhood educators, we're very concerned about transmission from children and children catching things. But in the case of COVID-19, it's actually the adults that are more common carriers and who are more commonly getting infected. So that's something to keep in mind. Something else we want to talk about is hand sanitizer safety and children. And so this is something that a lot of people have questions about, so it's good to clarify a few facts. So alcohol-based hand sanitizer is dangerous if ingested, particularly for children. So some safety tips are to store hand sanitizer products safely and out of reach of children. So treat it like a chemical. It shouldn't be in reach of children. And unfortunately, we are seeing them kind of everywhere now. It's very accessible, and it's often in places like on the top of the sign-in sheets where children can reach them. So it does need to be treated as a chemical, and you should have an MSDS sheet for it as well. Any use by young children should be under supervision of an adult, so making sure you supervise them. Be aware of imported products which may not be clearly labelled and may contain more toxic alcohols such as methanol that make the product more dangerous. And just think, once you've put it on a child's hands, they can rub their eyes, they can put their hands in their mouth, and that can cause them a lot of irritation. So just be really aware of when you're using it. Washing hands with soap and water for at least 20 seconds is a safe and effective option. So hand washing is still the best way to go. It might be really tempting to use hand sanitizers in a time like this for children, but hand washing for 20 seconds is still the safest option. So we'll have a look now at cleaning, which is something that we need to consider as family daycare educators now more than ever. So the first thing we look at is frequently touched surfaces. So these things are called high touch surfaces. So that's things like your play gyms, and they might be indoors or outdoors. Tables, chairs, doorknobs, light switches, remotes, handles, desks, toilets and sinks. So these high touch surfaces in your family daycare home that either children or adult, including other adults in your family, touch frequently. So the Australian Health Protection Principal Committee, the main government body which is charged with protecting Australians from coronavirus, have advised that these surfaces need to be cleaned and disinfected daily. So I understand that that's a lot of extra work, but it really should be done as part of normal cleaning and infection control processes. And I guess as family daycare educators, our responsibility is twofold. We need to keep our own families safe as well as the families of others. So although it is a bit of additional work, it's really important that we do it at this time. We then also look at minimally touched surfaces. So these can be cleaned and disinfected at least weekly, once a week, and also wash and launder things such as plush toys frequently, things that can sometimes get forgotten and don't get washed for a very long time. We need to now bring those to our attention. So wash and launder play items and toys, such as soft toys, um, appropriately in accordance with the manufacturer's instructions, and if possible, launder items using a um, warm water, the warm water setting, and for other items, and dry them completely. So making sure, and air drying is the best. Sunshine's really good for killing all those things and making sure that they're aired out and dried properly. Drying is a really important part of the cleaning process. And so now that we've looked at what we need to clean, it's important that we know what to use to clean as well, because this can get a bit confusing sometimes. There's a lot of information out there, so it's important that we clarify what to use. So cleaning and disinfecting are two different processes. So when we talk about cleaning, we mean working using soap or detergent and water to physically remove germs from the surface. So this process does not necessarily kill germs, but by removing them, it lowers their numbers and the risk of spreading infection. And when we talk about disinfecting, we're killing germs on surfaces or objects. So they're quite different, but they both play very important roles. So cleaning means physically removing the germs, the dirt, and the organic matter from surfaces, and disinfecting is killing the germs on the surfaces. It's important to clean before we disinfect because dirt can reduce the ability of disinfectants to kill germs. So a combination of cleaning and disinfection will be the most effective to remove the COVID-19 virus. So we want to be doing both cleaning followed by disinfecting. Cleaning reduces the soil load on the surface, allowing the disinfectant to work and to kill the COVID-19 virus. Disinfectants may not kill the virus if the surface has not been cleaned with detergent first. So that just gives you a bit of an idea about the importance of both those processes. So what do we clean and disinfect with? So we clean with detergent and we disinfect with disinfectant. So to kill germs, any disinfectant must have enough time in contact with the surface to kill the germs. We do this by following the manufacturer's instructions. So always read it, especially if you're diluting things, making sure you're using the correct quantities, which then gives us the correct concentration. We want to apply it to a clean, dry surface. And we want to be effective against those particular germs. So Glen 20 surface spray disinfectant or hospital grade is one such disinfectant. So they're the ones, they're good examples of what you want to be using. So the Australian Department of Health says you should use a disinfectant that claims antiviral activity, meaning it can kill a virus, such as chlorine-based disinfectant. And this is different to an antibacterial cleaner. So antibacterial cleaning products contain ingredients to eliminate germs and bacteria, such as E. coli or salmonella. While you can still use these products to clean surfaces, the antibacterial ingredient themselves will not eliminate COVID-19. So if you are looking into purchasing disinfectants, you really want to be looking for antiviral disinfectants. And then we look at the process of how do we clean. So how do we effectively clean things? So there's 5 main steps that we look at. We use detergent and warm water. We follow the manufacturer's instructions on how much detergent to use. We vigorously rub the surface to physically remove the germs. We rinse the surface with clean water and we dry the surface. So clean the cleanest areas first and then the dirtiest. So it seems like simple advice. Um, and I'm sure as family daycare educators, you're all confident and competent cleaners, but it's good that we do this process all the time. So it's good to sometimes just have a reminder to step through each of those 5 steps. And as I mentioned before, the drying component of cleaning is one of the most important, but sometimes it is one of the forgotten steps. So really making sure you're drying those surfaces. It's a lot harder for viruses and bacteria to grow on dry surfaces as opposed to, on wet surfaces. No, on dry surfaces as opposed to wet surfaces. So drying is a really important step. Okay, so the next thing we'll discuss, which is a really important topic, is excluding sick children and adults. So the Australian Health Protection Principal Committee have said that those children with fever or symptoms of acute respiratory infection, so anyone presenting with a cough, a sore throat, a runny nose, shortness of breath, any of those symptoms must be excluded from childcare. So this means you should be excluding more children for sickness than usual. I know that we're coming into winter and we're also coming into the flu season. So those symptoms in children are very common. So you will most likely see an increase in children that you're sending home. And I know that sending children home can be really challenging, especially when you've got parents in stressful work environments, stressful situations. But we have to remember at the end of the day that this is to protect everyone's health. It's to protect the children, your families, their families. So there really can't be much negotiation around sending children home. If they're presenting with those symptoms, they mustn't be in care. And that brings us to the other point that if you're experiencing any of these symptoms as an educator, um, or if any member of your household is experiencing these symptoms, that you really should not be conducting work as a family daycare educator. So we understand also that this means income loss and it can be really challenging. But I guess at the end of the day, if we think that the other alternative is we might be responsible for a COVID-19 outbreak at our service, I think, closing or not operating if we're unwell is a much better option. We don't want to be responsible for spreading that virus. So really important. I know it can be a challenging thing to do for everyone, for parents, educators and children, but anyone showing those symptoms must be excluded. So, as I mentioned before, the risk to you as an educator, really, it's coming from other adults. And this is quite novel in the early childhood industry. We're really used to children being the infectious party and spreading those germs. But there has been an absence of outbreaks in early childhood centres globally. But there isn't actually clear evidence that children are susceptible. There is clear evidence that children are susceptible to the COVID infection. So the role that children play in transmission and amplification of COVID-19, it remains largely unknown. There's still a lot of uncertainty about what role children are playing with this virus, but we do know that you're much more likely as an educator to catch it from other adults, so parents, carers, other educators, whoever you're interacting with, as opposed to contracting it from the children. So also the ones that you live with, the adults in your family that live in your household, um, or any other visitors that you have, or parents dropping off children. So rather than focusing on the children, a lot of our focus is on managing the adults that are coming in and out of our services. So you need to make decisions about how to manage this. Some services have implemented the following strategies to try and manage this. So asking for only one parent to do pick up and drop off, minimizing visitors and extended families, so grandparents coming to the service, signing children in at the entrance rather than letting them come right through into the service, postponing any family or community events, and restricting restricting students and casual staff. So putting those on hold as well. So it's really the adults in our community that we need to be mindful of. We also need to consider the importance of immunisation. So the Australian Health Protection Principal Committee they initially recommended that all educators and children should only be allowed to attend childcare if they have had the flu shot. But this information has since been amended, and it's now just a core risk minimisation measure that children, educators and parents should receive a flu vaccination. So it's not compulsory, but it is highly recommended. Some organisations have made immunisation compulsory for all employees, such as Good Start, Early Learning. They insist that all their educators, all their employees have had their immunisation done and it's up to date. So even if you've never had a flu shot before, it's a good time to think about having one, checking if the children you care for have had one, and getting one for everyone in your family. Influenza vaccination is provided for free under the National Immunisation Program for all children aged 6 months to under 5 years. Children aged over 5 years who have high-risk medical conditions are also eligible for vaccination under the National Immunisation Program. People with a range of medical conditions are also eligible for a free flu vaccination, so you can ask your doctor about that. It's estimated that 78% of Australians are immunised for the flu this year, and that's a big jump on last year's figures. So we're seeing that possibly in light of COVID-19, more people have been motivated to get the flu shots. And you need to be organised too. Some medical practices can run out of flu shot. There is a finite number available. So it's good to not leave it too late to make sure you get that done. And the last thing we're going to look at tonight is social distancing. So greeting parents and children at the front door in the morning and during pickup times will allow for one-on-one communication with families while practicing physical distancing and providing opportunities to consider whether children are showing any signs of being unwell. So you can do a little triage assessment at the door and making sure that everyone looks well to come into the service. There's no evidence to support temperature screening as an effective strategy. I know this is quite common in the community at the moment. If you go places, a lot of people are screening temperatures at the door, but there's no current evidence to say that that's effective. People's temperature can fluctuate for different reasons, so don't feel that you need to stand at the entranceway with a thermometer. Um, but certainly, checking everyone as they come in, making sure, having a chat, making sure everyone's well. Being highly diligent about all staff, children, and parents washing their hands upon arrival at your service. This should be a huge focal point. Rather than wasting time checking temperatures, you're much better off insisting that everyone do their hand sanitizer or wash their hands before coming in. Talk about why everyone needs to wash their hands and the importance of this, and have disinfectant available for parents before they sign in. Consider spending more time outdoors. Consider the placement of activities and the amount of activities in the outdoor space. So just being a bit mindful about how you're preparing the indoor and outdoor environments, how things are spread out, how many children you have sitting at a table where you usually might have 4 or 6 children on one table at mealtime. You might want to spread them out a bit more. And obviously by spending more time outdoors, you're in the fresh open air. So it reduces the amount of transmission going on in the recycled air. Excursions should not be undertaken other than to local parks, so I'd be postponing all excursions. Public playground equipment could be used, but only if you have sanitizer available. Of course, it can't be expected that educators socially distance from children, so we're not saying that that's something that you should be practicing. But if you do an excursion, you would need to ensure that your children are separate from all other people. So you need to remain 1.5 metres apart from others. But we're not saying that an educator and a child need to stay 1.5 metres apart. It's not practical, it's not realistic, and it's not best practice. That's not what we're trying to achieve. You need to socially distance as much as possible from parents, though. So we've really stressed that tonight, that the real threat here is adult to adult interaction and transmission. So I would be practicing that 1.5 metres with parents at pick up and drop off, or if they're coming into the service. So following on from tonight's webinar, the best source of information for infection control is always staying healthy in childcare. This book is available and you can download a copy if you don't already have it, but all childhood educators should be referring to this frequently on an ongoing basis. They're up to the 5th edition, so make sure you have the 5th edition to have the most current, reliable information. But you can download a copy of that. You can order a hard copy form. But following on from tonight, that is the best place to get information on infection control. Safe Work Australia also has a massive material. There is a lot there and it gives you really specific information. For example, what to do if someone like a child or parent is found to have COVID and you need to do a deep clean. So there's really useful practical information. You may just have to spend a bit of time sifting through and finding what it is that you need. But really useful stuff there on Safe Work Australia. And the Department of Education can also answer any other questions. And their phone number and email is up there on the slide for you. And the Safe Work Australia link is there, as is Staying Healthy in Childcare. So for those who came in a bit later, all the slides that you've seen tonight are available for you in the handout section. It's a PDF document, so you can download that and keep that, so you'll have all of these contact details. So that does bring us to the end of tonight's session. There was a lot of information, so I hope you have gained some useful info to take back to your services. When you leave the webinar tonight, there will be a short evaluation survey, which we'd love you to complete. And your feedback really enables us to continue to deliver relevant, current, and high quality professional development. So if you could take a minute to fill that in. But thank you so much for joining us today, tonight, and we hope that it's been a great use for you. Great. So that brings us to the end tonight, everyone. Thank you so much for joining us, and we hope to see you at another webinar soon. Thanks, everybody. Bye.